Good morning.
Good morning, everybody.
Morning, friends. Happy Friday. Happy Forge Friday Coffee Talk.
What number are we on?
It is Friday, and we do have coffee. We're getting close to 30, actually. 30, we're like 20, this might be 28 or 29.
Nice.
I really should look at that before we sign on. Come closer to me. There we go. Look at that. So welcome. Happy Friday. It's pretty chilly down here in Florida for Florida's sake. I mean,
Northerners going to laugh at us.
I know, yeah. But it's still pretty chilly. We did not get any snow last week, unfortunately. I was hoping we would, but our neighbors to the northwest of us were like snowboarding down the street and like snow on the beaches. It just looked really fun. But no snow, just lots of cold and some rain. But it's beautiful today. The sun finally came back out. So now that you know our weather. So today we're doing part 2 today of our little mini low back series. Last week
we talked about basically the causes and kind of the misconceptions that people might have about where back pain comes from and its origins.
Yeah.
And this week we're going to talk more about what do we do about it.
Yeah. We touched last week on how we as specifically performance physical therapists can and should be your first line of defense when it comes to really just pain in general, but back pain specifically. That tends to be not where people go to in their minds first thing when they get, because back pain can be scary, but
first thought tends to be, oh my God, something's really wrong with me. I got to go to the hospital. Because if you've experienced low back pain, like a really sudden acute episode of it, and it sucks.
Yeah.
Like it is debilitating.
Yeah.
You can't move, you can't get comfortable, you can't sleep, you can barely walk. I've been there. And
I've been there.
I think like most of the population has been there at some point or will be.
Right.
So there's that to look forward to, and we want to try to minimize that as much as possible.
Yeah. So with us being that first line of defense, we wanted to talk today about like what is it that we do what do we do? So if you come to us with back pain, what does that look like? What does a session with us look like? And kind of the progressions going forward. Why are we that first line of defense when it comes to low back pain? Yeah. And how are we different from, say, if you were to go to your doctor first or your chiropractor first or the hospital or even traditional PT, right? Because we definitely operate different than traditional PT too. So what sets us apart?
Yeah, so I think it all comes down first off to being properly assessed. Because with a back injury, there's a lot of things that could be going on. There are a lot of structures that could be responsible for what you're feeling that pain for. And we have to look at a lot of things, including the mechanism of injury. How did this happen? How long has it been going on? Is this something that just happened yesterday, or is this something that you've been dealing with for years? Intensity, the symptoms, like I know it sounds weird, but like we'll ask you, like, what does that pain feel like? Because some people say, man, it feels like there's a sharp stabbing pain, like it's a knife in my back. And other people say, like, well, it's this general achy feeling all over. Yeah. So again, all of those are clues that kind of start telling us what structures are probably involved and how we're going to have to deal with it. Yeah.
We touched last week on how, if your doctor sends you to go get some imaging, it's not necessarily going to tell us a whole lot, and it won't necessarily change how we operate on our ends of things, because that image is just a snippet in time, right? They're just taking a photograph. It's a picture in that one position in one period of time. We, on the other hand, will, through that assessment, we do our assessment. Wow, like we get a thorough history. A lot of that first session is us talking and asking questions and getting to know what's going on better. But then we get you moving. The body is meant to move. The human body was created with movement in mind, right? So if you just take one snippet and try and make a whole diagnosis off of one image in time, you're not going to get the full picture. So we very quickly, after getting a lot of history, will get people moving. We look at posture, how you're standing, how you're sitting. We look at how you're transitioning from one position to the next, from sitting to standing, how you move through your ranges of motion. We're looking at a lot of things too that people don't even realize we're watching, right? Oftentimes we're watching people even when they're just getting up from the couch to come back to our room. There are things that we pay attention to when you're not paying attention, when you're not realizing it, right? Because that tells us a lot as well.
A lot of times we don't even know we're doing it either.
True. Yeah. And we've been doing it so long, it just kind of happens. We don't even recognize it.
You show someone a picture and they'll be like, oh my God, I didn't realize my spine was shifted that way.
And they don't realize it too. Yeah.
So yeah, it's that recognition. And like I said, that's the benefit of us doing what we're doing with Forge, is that we do have the time, because a lot of times in other medical offices, or you go to the hospital, man, they got like 3 minutes to deal with you. So they can't get a thorough history. They don't really know what's going on. Give me the TLDR thing. Yeah. And then let's get you some meds and let's get you out the door. Right. So does that fix the problem? No. It can put the fires out a little bit. Yeah. But that's what we're going to talk about next, is really, how do we really put that fire out?
Right. So the first thing that sets us apart is the time we spend. That assessment is thorough. I usually tell people that first visit's usually like 60 plus minutes. It depends on how much we're looking at and how much we have to dig into, but we spend the time with you and you're just with us for that visit, right? So moving on to just kind of our process. So we talked about the assessment process. Generally speaking, on a global picture, we usually talk about a 3-step process. So the first step being, again, once that assessment is done, the first step being putting out the fires. So he talked about that. We want to calm things down, right? So it's all going to depend on how flared up everything is, how chronic the situation is. But putting those fires out first. Then then from there, once everything feels better, we move on to reteaching the system. That's our step 2, is kind of reteaching or teaching your body's system how to move and function and operate in these better positions. Now that you're feeling better, let's get you moving in the right ways, because that's kind of how we got to this position in the first place. The body wasn't, for whatever reason, wasn't moving in the right way. Things weren't communicating the right way.
Can we back up just a second though and talk a little bit more about how we're putting out those fires?
Yes, but I'm just kind of laying out the map here. So putting the fires out, reteaching the system, that second part is kind of really where we distinguish ourselves from every other professional that you could go see for your back pain. And we'll talk about why later. Then once everything is moving in the right ways, we move into actually loading and strengthening in those proper patterns. So step 1, put the fires out. Step 2, reteach the system, which is what puts us apart from every other professional, and then strengthening and really loading the system. Okay, now let's go back. I want them to know where we're going with this conversation.
Gotcha.
So let's now revisit step 1, putting out fires. What are we doing to put the fires out and to help things calm down?
Right. So like I said, there's different levels of people coming in. So like I said, if something's really flared up, and like let's say someone's hobbling in and they can barely move, they haven't slept in 3 days, there's a lot going on, and there's a lot of fear going on with that too, because people are thinking, what the heck's wrong with me? Back injuries are weird in a way because you can't really see it. Yeah. Shoulders, extremities, knees, something like that. You can point right to it and say like, there's some problem there.
Sometimes you'll even get like, your knee will be swollen. It's like, well, duh, something's going on in there. But your back, that's not always...
Yeah. So it's hard to see it. So that's where that imaging wants to come into play. A lot of people will want to get that imaging done, and we talked about that last week. But we can tell from our clinical tests that we're doing pretty much what structures are involved. So a disc is going to behave a different way than a strained muscle will. Any other kind of nerve impingement, we can do little tests in office and see what's going on. And it's pretty simple, but it's like, what makes it better? What makes it worse? So if we find some things that make it feel better, and for me, I find like distraction works pretty well, especially like there's inflammation in the tissue, it's squeezing on that nerve. That's where that pain is being generated from. So we have to figure out what structures are irritating that nerve, and can we take the tension off of the nerve to allow it to calm down.
When he says distraction, he means like take 2 things and pull them apart. So it might be like your vertebrae, right? They line up on top of each other. If the muscles around that vertebrae, those backbones have been tweaked or strained, or they're really, really guarded. Here, use your hands on mine. Like if you're like this, right? They're gonna, well, like here, if the muscles are guarded, never mind, whatever. Here, if the muscles are guarded and they're on either side of the vertebrae like this, and they're guarded, they're gonna be tight, and they're gonna be pulling and compressing those joints. Just with distraction, you're actually kind of separating those a little bit, giving some space so that they're not so compressed and pinching down on those nerves because of those tight muscles. You stretch those muscles out, you pull apart those, and we do that sometimes by maybe pulling on the hips, pulling on the leg a little bit, hanging from a bar. There's a lot of different ways we can do it. But that's what he means by distraction. So,
and so that's kind of passive mechanical stuff. So if it feels good, cool, we're going to do a little bit of that. But if those muscles are so super turned on that as soon as you let go of that distraction, the pain comes right back, well, now we've got to do something else about those muscles. So that's where some of our manual work comes in, soft tissue massage, and it's not flu-flu-y massage of like what you're going to get at the spa.
Right.
This is very targeted to those areas to get those muscles to let go of that tissue that it's supposed to be not holding on so tightly to.
Yeah.
I've been kind of dabbling with a bit of dry needling lately. That's kind of having a lot of success with people, seem to like it. If you can get over the fact of having small needles being put into your muscles.
Yeah. Again, that's different from, say, like acupuncture, right? It's a different, you might be using similar needles, but it's a different intention. So with acupuncture being more like related to energy channels and things like that, this is much more directed towards muscle fibers, guarding, if you want to call them trigger points, whatever words you want to use. But again, just kind of disrupting that guarded pattern. Is that all of what we're talking about? Manual work, soft tissue work, dry needling, that's all targeting these, trying to disrupt this guarded, safety mechanism that the body goes through. Mm-hmm. So that's kind of all, and that can sometimes it takes a couple of sessions. Sometimes people feel really good and a lot better after like one or two. Sometimes it takes a little bit, especially if it's been something that's like really guarded, or really chronic, where it's been going on for a long time. Yeah,
it's a process, but the whole idea is that we're calming down that system in order to get you moving properly again. Exactly. And that's kind of what leads us into that second stage of treatment of what we're doing.
Yep. Yeah, because if you're still fired up, everything's like super guarded and flared up, the body won't let you move in a good way. Like it's right. Just, that's the whole point. That's what's happening. So this whole cycle, this whole vicious cycle. So put out the fires, using our hands, oftentimes using positional cues, right? Sometimes I spend a whole session talking with people on like, how are you sitting at your desk? How are you sitting in your car? How are you sleeping? Let's see if we can change and make little adjustments of the things that you can control. Sometimes even that alone can make a huge difference. So a lot of that is all about putting out the fires, getting things calmed down. Then we get to step 2, reteaching the system. This is where the magic happens. This is often where, for one thing, if you go to a chiropractor, they might be putting fires out, but they're doing a lot of like manual/modality work. Maybe they're using an actuator gun, something like that, where they get you feeling better in the moment. But they're not following it up with this reteaching the system part. So you might start to feel your symptoms again, if the same, if not worse, a day or two later. If you go to your doctor and they say, well, take these pain meds, that's putting the fires out temporarily because you're just masking the symptoms. So all of that stuff can put fires out, but it's only temporary. This reteaching the system is where the magic happens, where we now take your body that's now moving better because the body that's feeling better because it's calmed down. And we're going to then kind of also revisit what we found in our assessment, that very first visit, where we saw, okay, these were the movement deficit, the strength deficits, the movement imbalances, muscle imbalances. We now know what those were. We've got everything calmed down. Now let's teach the system how to kind of how to move better so that we're not doing these imbalances. We're not doing these movement impairments anymore. Right. If that makes sense. So that involves a lot of talking, us educating, us, with our hands, like, hey, maybe try this instead of that. Hey, can you lift this hip a little bit higher? Hey, there's a lot of tweaking and kind of, small little details going on in some of these next couple of these early sessions, because that's where our trained eye really, really comes into play. And that's where we set ourselves apart from even traditional physical therapy. So you can go into a traditional physical therapist's office and traditional healthcare, and they might be really great at, again, like putting fires out, just kind of teaching you like baseline exercises, but they often will neglect the component of it, of actually really progressing you through and spending the time with you to find those nitty gritty details and movement pattern impairments. That is really what's going to like unlock the whole thing.
Right. So you could take someone who, when they came in, they originally could not bend forward. Like the thought of going forward and trying to touch their toes was just out of the question, not going to happen. So if we've got things calmed down enough to a point that they can now begin to start bending down toward the toes, we want to see what's the quality of that look like. Right. Are they still guarding? Because again, there's a fear factor that goes on with that. You think you're going to hurt yourself again by doing that. And that is a risk. Yeah. So we want to do that under guided eyes to make sure that you're doing it correctly and that the muscles are firing in those patterns. So the muscles that are pulling you forward to touch your toes are also balancing out with the muscles that are trying to control that downward movement on your backside too.
Yeah. Yeah. And oftentimes we find, we take the movements that have been previously bothering you and let's like scale those back a little bit. So sometimes teaching somebody how to touch their toes in a standing position might look a lot like, well, let's lay down on the floor first and kind of, get similar positions and similar movements, but doing them from other more like gravity assisted positions first. We'll take things and kind of like roll them back, scale them back so the body can tolerate it more and feel safe in those movements, in those positions. We have to, so he mentioned the emotional component can be a really big factor of it too, not just the neuromuscular component of it. So a neurologic component too. You had that quote that you like to say,
I said we want to turn on what's not firing. So again, if this is a chronic issue, you probably got some muscles in there that have been sleeping for a real long time and other muscles have been doing their job for them. Right. So those muscles that have been doing the job for them are a little overactive. They're super, we will call tight, guarded, whatever you want to call it. And so we want to make sure that we are turning off those ones that are overactive, which is what we typically think of as stretching. So that's why a lot of people just think they're going to stretch out their tight back and that's going to fix the issue. And that's part of it. So we want to stretch what's tight and then we're going to actually get turning on those muscles that have been sleepy for quite some time. And when you make that happen, you can get some soreness and everything that's going to be associated with that. So we want to guide you through all of that process too.
And another thing to note too, it's not always about stretch the ones that are tight. Sometimes things become guarded, and almost all the time, usually things become guarded with a sensation of tightness, which we've talked about before, but it's because those are also weak. Like when stuff like this happens, when we have an injury or we have pain, it kind of sends these signals out to the whole system of like, hey, we have to protect this area and let's kind of start shutting everything down. So it's not only like, well, this muscle on this side is tight, therefore this one is weak, and so we have to only work this one. This one's tight or has a sensation of tightness because it's also weak, and so everything is just out of balance. So we try to just balance everything out. It's not like, well, I'm only going to work this one side because this is the side that's tight and guarded. It has to all work in conjunction with everything else. There's lots of diagonal and rotational patterns in the body that have to work together too. So again, if you're only working one side because you feel like, well, this side's doing all the work, so I'm going to only work this other side, that doesn't really translate. You have to really operate in these diagonal rotational patterns, and because that's what's functional. So that was kind of a lot, but that retraining, step 2, the retraining the system is where the magic happens. That's where we differ from your chiropractor. That's where we differ from your just GP physician who's just going to give you meds and send you to the x-ray machine. That's where we differ from even traditional PT, traditional healthcare, because we can take it beyond just that. Oh, you're doing okay. You're feeling a little bit better. All right, discharge you. Let's wait till it happens again. We then take it to that next level of actually finding the root cause, retraining, so that this doesn't happen again, which then unlocks and opens this step 3, which is the fun stuff. That's the fun stuff. That's the sexy stuff. It's loading the system. It's strengthening. It's, now that you're feeling better, you're moving better. Now let's load it. Let's load the system. That's the fun stuff. That's where we start to get people using some dumbbells and some kettlebells and maybe eventually, get them under a barbell, depends on what we're working on. Right. But
always tailored to their goals.
Right.
So, we have a runner that comes in, they're going to be probably training a little bit differently than the Olympic weightlifter. But we want to try to get a balance of a little bit of everything. So, if we're seeing some weaknesses in the runners, then we definitely want to strengthen those. And if we're seeing some immobility in the Olympic lifter, we want to get them stretching and moving a little bit better into some ranges that they haven't been. So like I said, it's just trying to create a more complete picture of the total athlete. And when I say athlete, I mean everybody who walks through our door.
Yep.
And like we said, it's that strengthening and loading part. So we start actually getting that area so strong to the point that the risk of the re-injury becomes less and less and less over time.
Right. Yep. Yeah. So, with that resetting or reteaching the system, that stuff sometimes can be seen as like the boring stuff, right? But that stuff is what's laying the foundation so that we can get into the fun stuff later on. There are some people that come to us like runners who maybe have never done strength training at all because all they like to do is slap their sneakers on and go run a couple of miles. They need to strengthen just as much as the CrossFitter needs to strengthen. And so, like you said, we may approach it in a different way, but yeah, as long as we can get through that step 2 where we can find some consistency, right? Because it can take some time, especially if it's been going on for a long time. Like this stuff doesn't often just you blink and then 2 sessions and you're ready to go, right? You kind of need to like push through that there is that phase where I feel so much better. Awesome. Why don't we save these last couple of sessions and I'll call you when I need you again. We're like, no. That's like, I'm glad you're feeling better, but we're right at that sweet spot where like we actually want to push a little further into that realm of, okay, let's take advantage of feeling better and keep reteaching the system so we can get to that strengthening part so that this doesn't happen again. I don't want you to call me in 3 months being like, oh, it happened again, because we didn't really truly follow through with all 3 steps.
Yeah. I would say it's like pulling the cake out of the oven halfway through the baking process. You see it puffing up.
It looks like it
hey,
might be done.
Great. Smells great. Let's take it out of the oven, and then you'll watch it all fall flat.
Or you put your little like toothpick in it, and it's still super soggy on the inside. So yeah, that's a perfect example. You gotta really cook the cake all the way through. I know. Yeah. No. Ooh, you do have a little treat from Miss Jilly in the fridge.
Oh,
though.
yeah.
Love you, Jilly. So I think that's about it. That's it in a nutshell. And really this process, we take people through this process with back pain, but we take people with shoulder pain and knee pain. And it's the same general process, right? It's just what areas are we focusing on? That changes. So,
and every individual is going to be a little bit different.
Yeah.
Some people will get through one phase fairly quickly. Some people might not even have the fire to put out. We have some people that come to us with no pain at all. They just want to get moving better.
Or they're like, hey, it has been a factor in the past. I want to now make sure it doesn't happen again. Like they, maybe they're not in a flared up state, but they want to start protecting themselves so that it doesn't happen again. So yeah, we take people at all phases, all stages. So, but that's the general process. We're doing a really thorough assessment, putting fires out, reteaching the system, and then loading the system. And we've had some really amazing success with that. And because that's just the way it is. This is the way.
This is the way.
This is the way. If you have any back pain, if you've been dealing with it in the past, if you have it right now, if there's something like, oh, I don't do deadlifts with a barbell anymore because it hurts my back. Call us, message us, put a comment down below, shoot us a DM. We want to help because we can. And we just want everybody to be able to move and do all the things they want to do for the rest of their lives. Right?
Got it.
Cool. That's it. Y'all have a great weekend. We're going to have a great weekend. We're heading down to St. Pete today to go hang out and see a concert and just have a lot of fun and go do some city exploring.
Yeah. Beautiful weather.
Beautiful today. All right, y'all have a great weekend. Happy Forge Friday Coffee Talk, and we'll see you next week.
See you guys.
Bye.